Well, we are in the middle of an alert day with another one on the way tomorrow because of the dangerously cold conditions. And these conditions can really take a turn if you aren't careful. This afternoon, we have Dr. Jonathon Brewis, a ProMedica Toledo Hospital emergency medicine doctor with us. Dr. Brewis, thank you so much for doing this with us this evening. What are some of the dangers of being out in these below freezing temperatures for too long?
Yeah, thanks for having me. So some of the biggest dangers that we see, especially coming into the emergency room, patients having prolonged exposures can have frostbite, which comes in various forms. It's sort of like burn victims will have various degrees of burns. Frostbite comes in similar scalar fashion. And the best way to prevent that is to just not have prolonged exposures. There's also some other sort of less nefarious forms of cold exposure injuries, typically involving wet environments. So if you get snow in your boots or in your skates or something like that, and you're out in the freezing temperatures, it can cause a sort of a variation on frostbite as well. In addition, we need to be careful in a particular way with diabetic patients because their nerve endings oftentimes don't work quite as well. And anybody who's sort of suffered from diabetic neuropathy in the past kind of knows that their nerves are a little bit less sensitive. So that includes things like exposure to cold. They might not have the warning system that you or I might have. And then sometimes our cardiac patients as well, especially if they're out exercising in the cold. The cold environment puts a significant stress on the cardiovascular system. And if you layer exercise on top of that, for patients who don't have a strong heart, that can be a bit too much for them and can suffer complications from that as well.
What are some of the early signs of hypothermia or frostbite that people should be aware of and look out for?
Yeah, so typically, sort of a stinging pain is kind of the first sign, and that's not in and of itself enough to sort of call something frostbite. But you may start to see some color changes in the fingertips is oftentimes where you'll see that color change to kind of a pinkish red. And in more severe cases, you can actually have what looks almost like bruising or blister formation. And those are a little bit more serious cases of frostbite that definitely need to seek medical attention. If there's a small amount of, what we call erythema or redness, along with some stinging pain, oftentimes, you can kind of warm your fingers yourself in some nice warm water and see if that kind of resolves the issue. And if that's enough, then then you don't then typically there's not much else that needs to be sought in terms of medical attention if you catch it early. So that is, something that we would recommend is that, patients are keeping an eye on that and not to ignore the early symptoms, including kind of that stinging pain.
How long is too long to be outside before you even start noticing some of those symptoms?
So that's going to vary in part on the type of gear really that people have. The cold weather gear can be highly variable, but for sort of average people who are kind of using your typical snow coats and gloves that you might buy at Walmart or something, typically 10 to 15 minutes is probably enough exposure. So if you need to be out more than that, you should definitely try and break that up as much as you can and rewarm in between. The longer you have exposure, the effects are sort of cumulative. So if you can kind of break that cycle by having periods intermittently of rewarming, oftentimes it kind of hits the reset button on that process.
And last question for you here. We only have about a minute left, but if you do have to be outside for a long period of time, whether that's for work or for sports, what steps can people take to really protect themselves? Is there anything beyond layering up that people can do?
Yeah, so layering is excellent. If you have, you can find some of these hot hands devices, which can be good. They actually do. There's a chemical reaction that kind of creates a dry heat. If you have the opportunity to again come out of the cold and sort of allow for some rewarming, that is going to be pretty crucial for individuals who have access to whether it's a fire or some kind of a space heater. Some localized heat sources can actually help with rewarming, especially in the extremities and the face as well. So obviously you have to be a bit careful with those implements, but those can actually be helpful in terms of tissue damage as well. So.
Great advice, Dr. Brewis. Thank you so much for joining us and for sharing all of these wonderful tips as we experience this very, very cold weather.